Welcome back to the Mountain Morning Show on Park City Television. I have live in studio with me Beth Armstrong and Meghan Miller from the People's Health Clinic. I'm excited to talk today. We're talking specifically about volunteering. Yes? So let's talk about, how many volunteers do you guys usually need in a day?
In a day, we can need anywhere between 2 volunteers and 10. It depends on how many patients we have scheduled and how many providers we have. Every provider has a different set of needs. Some providers need volunteers in the lab, some need interpreters, some need people to help them with medical records, and then we always need people doing vital signs and helping us maintain the flow of the clinic.
So vital signs, does that mean you're looking for like medical assistants? What kind of people are you needing?
People with a medical background are ideal, but we can train anybody in the community who has a desire to learn how to do it and is willing to come regularly. We can train anybody to take vital signs. They're very easy. It's temperature, which is done with a forehead scan, so it's non-invasive, blood pressure, which is an automatic cuff, pulse ox, which is a little machine that clips on your finger and it reads digitally, and then height and weight. So everything is super easy, and it's just teaching you where to put those numbers and what to tell patients sometimes when they ask about what they mean.
And then you also said interpreters. Let's talk about the different areas that a volunteer could be volunteering in.
We have a couple of volunteers that volunteer in all 3 of what we call our ancillary areas, so vital signs, the lab, and interpretation. Spanish is our #1 need for interpretation. Patients that speak just other languages usually bring their own interpreter, but we have a very high percentage of patients that like an interpreter present, and the providers like the interpreters because then nothing gets missed.
And then, so the vital signs, and then what was the other one?
In our lab. So if you're phlebotomy certified or you have a license that has drawing blood as part of your scope of practice, then you can work in our lab. We have a full lab, and so we draw blood, we do some in-house tests, we do some other samples, and we get them sent out. Intermountain sends us a courier twice a day to pick up all of our samples.
Cool.
So we do as much in-house as we can.
So when you guys are, getting volunteers, what kind of schedule are they typically scheduling out for? Is it just like once a week, once a month? Are they there 5 days a week? What are you seeing?
We have volunteers that come once a month. We have some that come weekly. We have a couple right now that are rock stars, and they're filling in gaps, and they're coming multiple times a week.
Really?
So those are our angels, but all of our volunteers, they make what they can give to us work with their schedules. So if they can come once a month, they're carving out a day a month to come in and help us out. So we appreciate everything. I never tell a volunteer that one is better than the other, because I appreciate that they're doing what they can.
Right, and they're all giving time.
They are, and it's, without them we wouldn't be able to function, so we're grateful for all of them.
So how do volunteers get involved? Where do they find information?
Also, she's missing a big part of our volunteers, which is our physician volunteers, which we had a new one come in yesterday, Dr. Weed, who's very well known in the community. And
what specialty?
Emergency medicine.
Cool.
Yeah, and family practice. So he came in and decided that he would like to come in and volunteer with us, and so he's trying to figure out what his schedule looks like so that he can give us a day a week, which is fantastic. So if you're a physician out there and if you're retired, we can assist you in getting credentialed. If you were never licensed in the state of Utah, we can assist with that. So
those are cool aspects.
Yes, that really is.
Especially for a lot of retired doctors who may be retiring just for the ski slopes.
That's exactly right. We get a lot of volunteer clinicians because of that. They come to Park City to retire and realize you can just ski and hike so much, and then you want to give back, and we're a great place to do that.
So at the People's Health Clinic, you guys, I think we've talked about this before, you cover basically everything but emergency services. So what types of physicians do you have in-house?
We have everybody. We have family practice. We have a couple of ER physicians that come and they'll see family practice at the clinic. We have a retired neurosurgeon that sees patients that are dealing with a lot of chronic pain. We have a retired orthopedist that helps with bone and joints. He doesn't do any surgeries, but there's still a lot of need in the bone and joint department. We have pediatricians that come. We have a psychiatrist that comes. We actually have 2 psychiatrists now. One is starting in 2 weeks.
Wow.
So we're expanding what we are able to offer through mental health, and then furthering the provider scope. They're not physicians, but they're licensed to provide services. We have a nutritionist. We have 2 PharmDs, so they do our pharmacy oversight and they do medication reviews. They're essential, and it's wonderful that we're able to have them at the clinic. Not a lot of free clinics are able to offer medication management services. We also have We have a dentist that's coming a couple times a year, and then we have some volunteer dentists that would like to get involved. So we're trying to expand our program into dental care. I'm missing people. Who am I missing?
Chiropractic.
Yes, we have a
Chiropractic?
chiropractor.
Physical therapy. We have we had an acupuncturist, and so if you're an acupuncturist, come see us because I'd love to put that back into place. And I think that is close.
I mean, that
Yeah.
covers essentially everything that I could think of.
Yeah, if we've missed anybody, you're loved.
Are you taking also PAs and nurse practitioners?
Oh yeah.
Yes, our clinic coordinator is a PA.
Very cool.
So yeah.
Very cool. Okay, let's talk about an event that you guys have coming up in a couple weeks. It's all about dental health. February is Dental Health Month, as you guys informed me. Thank you. Now I'm in the know. Talk to me about that event, and if you guys need volunteers for that as well.
We do. It's February 20th is our Children's Health Day as part of National Children's Dental Health Month, and Park City has actually proclaimed the 20th as Children's Dental Health Day, which is awesome. And then we have proclamations coming from Heber City, from Summit County. I've heard Wasatch County is going to officially proclaim it, so that's wonderful that we have
awesome.
so much community support. But yes, we are going to need volunteers. We're going all day, 9 a.m. to 8 p.m. We are going to need volunteers to help with interpretation, to help with charting, to help bring patients back, to help us with instruments, to help us make sure that all the goodie bags are getting handed out, to help us make sure that all the goodie bags maintain or stay filled, because sometimes kids like to take apart their goodie bags.
So
And
Beth,
we're also, by the way, on the 20th, we're also having our regular clinic, so we need volunteers on top of the volunteers that we normally use for the day. So it's going to be a busy day at the clinic.
how many extras do you think you need?
We'll probably need at least 12 extra volunteers to get Children's Dental Health Day off smoothly. We can do it with fewer, but the more hands we have, the better it goes.
Right, never say no to a volunteer, as you
Never
said.
say no.
You
to
never say
volunteer.
no.
Beth, tell me real fast. I mean, you have all these volunteers. Tell me about the dentists.
So we have, we're still trying to nail down our last dentist. We were trying to get 6 dentists so that because it's a 11-hour period, we didn't want to have one dentist there for the full time. We have Marielle Parso, who is she does our dental care weekly at the clinic, so she'll be sort of the lead on that. We did this last year with her and one other dentist that is now moved out back down to California. So whenever we decided we needed to replace him, we also realized that we really worked them hard last year. So we wanted to.
But it was a huge success.
It was a huge success, but we're trying to see 22 patients in one day. So
That's
we're
awesome.
through the help of the Assistance League, we're getting 2 dental chairs brought in. They're the portable ones. So they bring them in, they plug them in, and so we'll be able to see, tandem 2 patients
That's
at
awesome.
a time in the
All right,
room.
Beth,
And
Megan, I'm sorry to cut you off, but we're running out of time. We're wrapping up the first hour of the show. Thank you guys so much for coming. I hope the event is a huge success as it was last year.
well, we'll come back
Yes.
before it one more time and talk about it, and then right after.
Lovely. All right, guys, that wraps up the first hour of the show. We still have a lot more coming up on the second hour. Stay tuned.